On the occasion of Breastfeeding Awareness Month, we have with us expert Dr. Trupti Bhargaw, gynecologist and IVF specialist, Ramakrishna Hospital, Dhar Road, Indore. Can you tell us why breastfeeding is so important for both mothers and babies?
I'm Dr. Trupti Bhargaw. I'm a gynecologist and IVF specialist. I'm working in a Cloth Market Hospital and also Ramakrishna Hospital, Dhar Road, Indore. Absolutely, breastfeeding provides essential nutrients and antibodies that helps to protect babies from infection and diseases. It promotes healthy growth and development of baby. Breast milk is easily digestible and cost effective. Breastfeeding is beneficial to mother also, like it reduces the risk of certain cancers like ovarian cancer, breast cancer, and also type 2 diabetes. And exclusive breastfeeding also work as a contraception in lactating mother. Breastfeeding also help in a speedy recovery of mother after childbirth. Breastfeeding also increases a strong bond between mother and child. I will tell you how. Firstly, the act of breastfeeding releases the oxytocin hormone, which help your uterus return to its pre-pregnancy size and may reduce the uterine bleeding also after childbirth. So we recommend start breastfeeding within first hour of the delivery or as soon as possible. Secondly, the close physical contact and skin to skin touch during breastfeeding promote a sense of security and comfort for the baby. And thirdly, eye contact and interaction between mother and baby during breastfeeding strengthen the emotional connection and communication. It helps to mother in recognizing and responding to baby's need more effectively.
What is the ideal duration of breastfeeding? For how many months should a baby be breastfed?
Ideal duration of breastfeeding according to WHO recommendation is exclusive breastfeeding for the first 6 months of life. And after 6 months, along with introduction of solid foods, breastfeeding should continue up to 2 years or beyond.
How would you describe the current breastfeeding scenario in India?
In India, breastfeeding is common practice, but there are significant challenges like lack of proper knowledge about breastfeeding, lack of support to women in the family or at workplaces, inadequate healthcare support. This problem can be improved upon by health education. Therefore, it is very important to teach expected mothers as well as families about breastfeeding.
What are some of the major challenges that mothers face and how can they be addressed?
The most important challenges that many mothers face are low milk production, improper latching or lack of good attachment, sore nipples, cracked nipples or clogged ducts or breast engorgement, mastitis or latching pain. And latching pain may be because of many times baby does not take breast into his mouth properly, so cannot suck effectively and it causes pain. So good attachment is important for breastfeeding. For that, much of the areola and the tissue underneath it should be in baby's mouth. Nipple का काला पोर्शन, निप्पल और उसका आसपास का काला पोर्शन ज़्यादा से ज़्यादा बच्चे के मुंह में होना चाहिए. When baby is well attached, his mouth and tongue do not rub or traumatize the skin of the nipple and areola, so no pain will be there. Basically, sucking should be comfortable for mother also. But in spite of good attachment, if mother had insufficient milk production, then don't worry. There are several supplements which can help to boost milk production. So consult your doctor and find best and safer option.
Doctor, any final message for our listeners?
I encourage all mothers to find support and information about breastfeeding. Go for breastfeeding videos. It is one of the best things you can do for your child's health. So, dear listeners, let's work together to create a supportive environment for breastfeeding in India. I conclude in one line, Jeevan ka amrit hai stanpan. Thank you for listening me.
Thank you so much, Doctor, for your time.